Dr. Lee.
Good afternoon, everybody. So today we will do a more detailed overview of what's happening on the ground in Alberta K-12 schools. Support Our Students has been trying to compile whatever we can get, which we know is only a fraction of what's actually out there in terms of case information and exposure in all the over 60 school boards. So if we can throw up my slides, I can just get right into it here. Thank you, Chad. Those are Goja slides, I think. So just to recap, what's been happening has not changed in terms of public health support for schools. There is virtually none compared to what we had last year. So AHS is still not telling any schools about positive case tests that come through their testing system. Schools have not been obligated since this beginning of this year to share positive cases with parents in the school community about potential exposures. Some divisions are sharing with their classrooms if there are self-reports, if parents decide to tell the schools. But we've also heard in some areas there is, I guess, recommendation or pressure for teachers to not share information, to withhold it for the sake of privacy. So this happened last year, this over-leaning into, the idea that you have to hide cases because of privacy, but there are ways to be transparent without giving identifying information that can adversely affect the individual. There is a balance here of making sure the community is aware and to assess their risk, like Dr. Vipon said. But what we're seeing is a ball of secrecy, and exposure information is a void. There's a void of information. And of course, due to that, we don't actually know any quantifiable statistics about school transmission as the data is severely lacking. Next slide, please. So SOS has received at least 82 outbreak letters from AHS since the beginning of the school year. So that is obviously not comprehensive. We know there's more out there that just haven't been sent to us. These letters basically say that an investigation has been opened in the school because the school reported 10% or greater absenteeism. So their school population has over 10% absent due to illness. So there is some questioning around the respiratory illness part of this letter, because some zones will divulge where there was COVID specific and some zones are not saying anything. So it's inconsistent across the board, but we do know that these letters are going to some schools. So from our count, at least 2,932 absentees, at the very least, at the minimum, have reported being away from school based on the 10% threshold. Of course, this number is probably greater because this is just a threshold that triggers this letter. And we calculate this based on the total enrollment numbers from last year. So knowing this year more students went back to in-person, of course, we would anticipate this approximation is conservative by all means. So what we do know is that when an investigation opens, there's actually no further guidance. So nothing coming from public health about quarantining any cohorts or additional measures. So really it's just a blanket informative process and nothing actionable in terms of what parents can do to continue to keep their child safe in light of the information that comes up. Next slide, please. And this is a list of just all the schools, and you can see that it's across all the zones. There aren't, a specific place that we've only been receiving these letters, so this is a province-wide problem. Next slide, please. And just replicating sort of what Dr. Vipon was showing, this is Aaron Tomb's graph of active cases by date. This was as of yesterday for ages 5 to 19. And we see we are approaching the peak from the third wave quite rapidly, of course, due to schools being open. Next slide. Dr. Vipon already shared this slide, and condolences to the pediatric uh, death that occurred yesterday, reported today. Again, this was all avoidable. We needed to have transparency and honesty about transmission in children from the beginning, and this government has been very adamant that the risk is minimal, and the rhetoric that children are not affected has been dangerous, and they're continuing to allow this virus to spread and not doing anything to help mitigate. Next slide, please. So last Friday, the largest school board in Western Canada, the Calgary Board of Education, sent a letter to the province urging the province to reinstate public health contact tracing, providing rapid testing kits for schools, and mandating vaccines for workers in the education sector. CBU reported that over 350 self-reports have occurred linked to over 120 CBE schools. And today we saw a letter with similar asks come out from the Edmonton Public School Board. And so this is an opportunity for parents that are watching, put pressure on your school boards to speak in unison with these two metro boards. I'm talking rural boards as well, north, south, central zone. The province needs to hear from those that are administrating schools and seeing what's happening on the ground, that the province needs to step in. School boards are not equipped to be public health officials, and having this downloaded onto them is creating a patchwork of inconsistency, and they need to hear a coherent message from the school boards. Next slide, please. And so for anyone that wants to see just a sample of what we've been receiving, you can go to our website, and we will continue to do our best, but of course we aren't public health officials either. This is just as a representation of what is unfolding as the crisis that is in schools. Thank you.